Let's talk about some of the biggest issues right now that I'm hearing. Raise your hand if any of these sound familiar. My team doesn't want to come back until they're 100% safe. Yeah, love it. Lots of people raising their hand. Emphasis on the 100%. Yeah, oh man. Yes, love it. All kinds of people raising their hand here. This is great. Yes, everybody. I think everybody shares this concern, and many more people have actually had their staff tell them this. And this is real stuff. This is real concerns that people have. How many people have a concern tonight that some of your team members may not come back because they're making more money on unemployment and this stimulus package we have right now? Oh yeah, lots of people. Yeah. And regardless, right, I'm not passing judgment. I'm just saying it like I see it. You got to look out for number one. If these employees think they can make more money on unemployment and that's the best path for them, we're going to talk about that here in a few minutes. But yeah, that's a big concern. Who's got concern about PPE? Getting PPE, what the PPE requirements are, how much it's going to cost, is insurance going to reimburse us, how are we going to mitigate aerosol, all this stuff. Yes, all kinds of stuff. Who's concerned about their state dental board saying you can't open or they're not recommending you open yet? Yeah, I got a few people. Here, let me ask a question not on here. Who was in love with their state dental board before this thing happened, before coronavirus? Raise your hand if you just loved your state dental board before this happened. That's funny. No hands are going up. I've asked that question for the last couple of weeks, and I have yet to see anybody raise their hands. I'll talk about that a little bit tonight. I think it's humorous, but it's not funny. It's just a kind of a shift in mindset. Who's upset? I've already seen some comments in the chat box that you're not considered essential. How many dentists in here think they're not considered essential? I don't. Yeah, who's concerned about this? Not what do you think? Just who's concerned? I think that's the biggest load of crap. But I'm going to talk about that a little bit tonight. We're going to skim over very, very high level, very quickly, oral systemic connection stuff. You guys know all this stuff. I'm just going to put a bow on this and wrap this topic up tonight. Who's concerned their patients may not come back in? Anybody have concerns about their patients coming back in? What their patients are going to do? Yeah, lots. I think the winner here was the most concerns were around the team members thinking they're making more money on unemployment. That seemed to have the most hands raised tonight. I didn't do an official count, but I think that's probably the unofficial winner here. I want to give you one tool here that's going to talk to a couple of these points. You guys have seen this in weeks past. We're continuing to evolve and iterate this. If you're a future client or a current client, we're evolving and iterating this. So every week when you come back, there's going to be more stuff included with this patient security and safety plan. You can go download this letter, and I'll send this link out afterwards. And we've got a whole template and system. You got to hang this thing on your front door. The patient security letter, you're going to wait in the car. We're going to come get you. You're going to call us when you get there. Non-patients stay in the car. This is a complete playbook for how you need to run your practice as the social distancing regs are still in place and you start to open back up. We've got to protect the vulnerable. And this is a best practices for dentist guide, along with, we're just giving you the letters. We're giving you all the stuff to go implement this. Also, if you're a client or you have our chatbot, our new patient assistant chatbot, we have now built in, as of today, we've built in the COVID-19 pre-appointment screening questions. You know, have you been in contact with anybody? Have you been out of the country? Have you had a fever? Have you had any diarrhea? All those questions we've built into our chatbot so that it can rapidly go through a pre-screening questionnaire before those patients get to your office. And do it in a way, you guys are going to be overwhelmed when your practice opens. We've got to automate some of this stuff. So in this package here that we're putting together, we've got an enhanced peace of mind letter. We've updated that for this week. We're recommending that you send letters, brochures, or a postcard to all of your upcoming appointments. Text and emails are great. Put the graphic, the sign on your front door, and give people your playbook right there on the front door. You don't want people wandering into your office asking what they should be doing. Add this information everywhere. The marketable attribute of this safety and security plan is the huge benefits. That's what patients are going to want. They want to know they're going to be safe. They want to know you take their safety seriously. Make sure you communicate it to them. Little things. I'll give you a couple things out of the playbook. When the patient sits down, you're going to wipe down the chair before they sit down, and they're going to see it with their own eyes. When the patient gets up out of the chair, you're going to wipe the chair down again, and they're going to watch you wipe it down. Safety that was once taken for granted is no longer taken for granted. Your patients want to see it with their own two eyes. When you take your instruments out of the autoclave, leave them in the sealed bag. Don't break the seal until the patient's sitting there watching and they see you opening this sterile bag up right in front of them. These are some of the things that you're going to need to think about, because this is all about reassurance. This is what this is all about. The safety, the clinical safety of this is there. I'm not discounting that clinically we have to do things. And if you want to know about some cool tools, look at last week's webinar. We went through all kinds of cool tools that you can use to put in your office. UVC lights, HEPA filtration, stuff you can do without breaking the bank. A lot of that stuff was $1,000. I've seen some doctors that send me quotes and it's like $100,000 to overhaul their practice. That seems a little excessive to me, especially before the requirements and all this stuff come out. But we can take common sense measures that don't break the bank, that are super marketable for us to give our patients and our team confidence. If you want your patients and team to come back and you don't want them to stay away, put these steps in place. Go watch last week's webinar. I'm going to tell you about more of it here. People no longer are going to assume they're safe. So how can we communicate that effort? That's what this is all about. Tell them about what you're doing, and then show them what you're doing. Demonstration is the most powerful form that reassurance can take. Just demonstrate it. And that's going to be everything your patients and team need. If you execute on this plan, I think you're going to have a leg up on all of your competition.